The following webinar was presented by Spokane Regional Health District to clients of Associated Industries on December 17, 2020. The information presented was based on guidance and requirements from the Centers for Disease Control and Prevention, the Washington State Governor's Office, the Washington State Department of Health, and the Washington State Department of Labor and Industries that were current at the time of the presentation. This information changes frequently, so it's recommended that business owners and operators routinely check for updates to regulations and guidance. Thank you to Associated Industries for allowing us to post this presentation on our website.
I'm Jenna Taylor here with my colleague Sandy Phillips, and we want to thank you guys for allowing us to deliver this presentation. I think it's a great opportunity to get information that can potentially be hard to find, to get that information out to businesses kind of as a proactive and prevention-based approach. Typically when the business advisors talk to facilities, it's after they've already had cases and we're focusing on follow-up. So hopefully this information will be beneficial in helping prepare for situations that might come up and potentially preventing them. So with that said, I'll let Sandy explain a little bit more about the Business Technical Advisor program.
Thanks, Angela and Jenna. Yeah, so the Business Technical Association program was started at the end of May this year. Health district epidemiologists at the time were identifying more people who had worked while positive with COVID-19, and they were concerned that the spread of COVID in the workplace could result in outbreaks. So the BTA program was developed by the Environmental Public Health Division to assist workplaces manage positive cases and, even more importantly, educate them on ways to prevent the spread of COVID in the workplace. So we currently have 4 full-time business technical advisors. We have 1 part-time environmental public health specialist, and then we also have 2 environmental public health technical advisors, myself in the living environment program, and then also 1 in the food program. And then we have 1 environmental public health program manager who oversees the program. So as of last Monday, which was December 11th, the program had conducted just under 2,700 business referrals since the beginning of May, so we've been quite busy. The BTA program has also completed more than 60 reviews and comments of COVID-19 safe operation plans for businesses. And then we've also reviewed plans for community events to help them operate safely and ensure that they comply with the Governor's Office and DOH guidance documents. Just to note, we don't approve plans, but we will review and comment, provide feedback to make sure that they're pretty inclusive and in compliance.
So the purpose of a BTA consultation. So when we're reaching out to businesses, the first step is to discuss the employees who have tested positive. So the positive cases identified at the work site, and then identifying any close contacts and potential exposures. We talk about testing, isolation, quarantining of other employees, whether workplace transmission is occurring. We provide guidance and answer any questions that might come up. We also go over prevention practices. We ask questions to find out what practices are already in place, and then we can recommend practices to implement that might help prevent the spread. And then after that conversation, we send a summary email that has links to lots of information and helpful resources in that as well. This is a list of some of the types of workplaces that we've consulted with. I won't read off every one, but you can see there's a wide variety. So we work with any workplace that has had a positive employee. In some scenarios, we also reach out to some of these kinds of facilities where it might just be a visitor or an attendee who was there while they were infectious. Those kinds of locations would typically be like salons or medical facilities, places where we can nail down a time visited or maybe a staff member who interacted with a positive person. So situations where informing the facility would allow for them to identify potential exposure. But you can see it's a large variety of businesses and facilities that we work with.
So aside from the discussions that Jenna mentioned about positive cases and testing and quarantine and isolation at workplaces, the BTAs also discuss the following items on this slide during a workplace consult. So whether the business has a safety plan, if they have any questions about that, or employee training. Also discuss health screening of employees, visitors, clients, anyone else that might, or customers that might be coming in. Employee respiratory program, make sure that masks are being worn when appropriate, and hygiene, so hand sanitation, hand washing, sanitizer use. Physical distancing, making sure that there's, at least 6 foot between people. Implementing measures such as shielding, if that's appropriate, and then cleaning and disinfection, which is important, particularly of high-touch surfaces. There's a link here to a good document produced by the State Department of Health on cleaning public places. And it also does include some information if you have had an employee or person at your work site who has tested positive for COVID. It gives you guidance on how to approach that, when to clean and how to clean. Another important item, ventilation, what type of system you have. Can you make any improvements on that to improve indoor air coming in? And then sick leave policies that encourage employees to stay home when sick. And just a little bit more information on ventilation to prevent the spread of COVID inside buildings. This has really been identified by numerous groups, including CDC, EPA, State Department of Health, and then ASHRAE, which is Association of Mechanical Engineers, to the importance of having fresh indoor air coming into a building to prevent the spread of COVID. So one of the things that's routinely recommended is to improve the filtration on your HVAC system if it can handle it. And what's recommended is to go with a MERV 13 or higher filter, and MERV stands for minimum efficiency rating value. So that stipulates the size of particle that can be filtered out of the air. And for a MERV 13, it can actually remove 98% of particles that are 0.3 microns in size or larger. So that can include bacteria, viruses, even wildfire smoke. So it's effective for that as well. If your system can't handle it, then it might be something to look at in the future when you're upgrading your system. Like I said, not only for things like COVID, but also for wildfire smoke. Another thing that's been recommended a lot, particularly on the EPA webinars that I've participated in, is the use of portable air cleaners with HEPA filters. So those can be particularly useful in smaller rooms that maybe don't have the best filtration. If a workplace had an isolation room where you would send somebody if they developed symptoms of COVID, that would be a good place to use it. Or a confined area, or maybe where there's quite a few people. Another recommended measure is to increase the amount of fresh air entering a building. So if possible, should have at least 6 air changes per hour. That's what's recommended by State Department of Health. And that basically means the number of times that the volume of air is changed over. Other measures you can take are to open dampers to allow more outside fresh air to come in. You can operate systems overnight, because a lot of buildings shut down at nighttime to save energy. But if you keep it running, it'll help to flush out the building for the next day. Other things you can do are to disable or override demand control systems, and even just good old-fashioned opening some windows and doors to let in some more fresh air. One thing you do want to be cautious about, though, is the use of floor fans, and we've been asked about this quite a bit. So they can be used to help exhaust room air out, say through an open window, But you want to be careful about not having a fan blow from one person to the next, because it can actually increase the spread of COVID. And down here at the bottom are a couple of links to State Department of Health good document that they came up with not too long ago on ventilation for any kind of public building. And then EPA, the second link there, has a lot of great resources on indoor air quality and preventing the spread of COVID.
So next, what happens when an employee tests positive? This link here at the bottom of the slide, it's a great DOH, it's a checklist actually. It tells you the steps that should be taken, but I'll go over those as well. So the first step would be to identify where the positive employee had worked, and then clean and disinfect that area. So if it's been less than 7 days since the sick employee was in the facility, you want to close off any areas or shared equipment that had been used by the sick person. If possible, wait 24 hours before cleaning and disinfecting. If that's not feasible, just wait as long as possible. And during the cleaning, it's important to think about ventilation and increase air circulation in the area. And then once it's been cleaned and disinfected, it can be opened up and used again. Next step would be identifying potential exposures. So that's identifying workers or clients who might have been exposed at work and instructing them to quarantine. So this is looking at close contacts. I'll talk more about the criteria for that on the next slide, but anyone identified as a close contact should be instructed to quarantine. They should be also encouraged to get tested 5 to 7 days after the exposure. Next step, communicating to the workforce. So it's a good idea to be transparent while maintaining confidentiality. So this can be an opportunity to explain the steps that are being taken and reassure the staff. It's a good idea to provide information about contacting the person in charge for any questions or concerns. We do hear on occasion from employees that they feel like they weren't informed about an exposure. And typically in those situations, they weren't informed because they weren't identified as a close contact. So just letting employees know that they can reach out if they are concerned at all might make them feel more comfortable. And then the person in charge can let them know how the assessment was made, can let them know that they had been ruled out as a close contact. And this can be done while maintaining confidentiality, but also being transparent, and that can help staff feel more comfortable. Also maintaining a list of confirmed cases, suspected cases, and exposed people, and then being familiar with the return to work conditions. Return to work conditions kind of applies to this, the quarantine and isolation period. So for starters, we'll talk about quarantine. Quarantine is when you were possibly exposed to a COVID positive person and you might develop infection. So it's a 14-day recommended quarantine period from the last exposure. Like I said before, on day 5 to 7 after the exposure, that's the ideal time to get tested, or sooner if symptoms do develop. If someone is identified as a close contact and tests negative, they should still complete their quarantine. And the reason for this is because it can take up to 14 days for the infection to start. And then another thing, so the CDC and DOH just recently released revised options to reduce quarantine in some situations from 14 days to 10 days. The reason for this is because the incubation period, which is the time from exposure to when an infection actually starts, can be up to 14 days. But in the majority of cases, it happens in the first 10 days. There's a small percentage that happens between day 10 and 14. So 14 days is the best route, but 10 days is an alternative to balance the burden against the small possibility of spreading the virus. So the 10-day quarantine, there's some criteria for that. So daily symptom monitoring must continue through day 14. If symptoms develop at any time, they should immediately isolate. They must strictly adhere to masking and distancing through day 14, and just in general as well, but it's especially important during those 14 days. And it's not to be used in certain high-risk settings. So like long-term care, healthcare, correctional facilities, those in those kind of settings, there should be the 14-day quarantine is required still. Isolation. So that's when you've tested positive or have COVID-19 symptoms. If that's the case, isolation can end after 10 days have passed since symptoms first appear, and at least 24 hours have passed since resolution of fever without the use of fever-reducing medications, and there's an improvement in symptoms. For an asymptomatic person who never developed symptoms, then it's 10 days from the test date. Requiring a negative test to return to work. So that is not a recommendation. The data has shown that people can test positive for a long period of time after they're no longer infectious. So a negative test is not a good indicator of infectiousness. That's why the time-based and symptom-based return to work strategy is what's recommended by CDC, DOH, and SRHD. Identifying close contacts. So when an employee tests positive and you're looking at close contacts, what we're looking for is people who are within 6 feet for 15 minutes or more throughout a 24-hour period. And that is during a sick person's infectious period. So that starts 48 hours before the symptoms start or 48 hours prior to the test date if they were asymptomatic. So that can be done by reviewing logs, looking at video footage, and interviewing the positive employee. If symptom onset is unclear or if there are no symptoms, well, for no symptoms, we're going off of the test date. If symptom onset is unclear, and that situation does come up pretty frequently, it's just better to err on the side of caution. And when you're looking at an isolation period, use the later date just to kind of err on the side of caution as far as the isolation period. Reinfection. So if someone has COVID and recovers, can they be reinfected? The CDC currently believes that there is very minimal risk of reinfection within 90 days from the initial illness. So after 90 days, it is a possibility, but within the first 90 days after onset of symptoms of the first infection, the current recommendation is that if someone who has clinically recovered from COVID and then is identified as a contact of a new case within 3 months, they do not need to be quarantined or retested. If it's more than 3 months after, then they should follow the normal recommendations. For someone who clinically recovered from COVID and then develops new symptoms, it's a little bit different, and they should work with their healthcare provider if the symptoms can be determined as something, or if they can't be determined as something else, then they maybe should get tested, but that's going to be on a case-by-case basis. It still is important to wear a mask, distance, and follow all the hygiene and all the recommendations, regardless of whether you've been previously infected or not. These are some helpful documents where you can find a lot of the information that I just explained. So the first one here is SRHD's testing quarantine return to work guidance. So that one explains all the different scenarios and the different time periods. The second one explains the same information, but in a flowchart form, so that can be pretty helpful as well. And then the third one, it explains it's situations where a person may have COVID-like symptoms, but have a negative test, or they have minor symptoms that are also common for other things. It's meant for schools, childcare facilities, and all non-healthcare workplaces. So it's guidance to help make decisions about how long sick people should stay home based on the symptoms they have. It breaks them down into Class A symptoms and Class B symptoms, and the length of time is dependent on which class their symptoms are in, if they've been diagnosed with anything other than COVID, and the results of their COVID tests. So what is an outbreak? An outbreak means that there's 2 or more cases within a facility and it was determined as workplace transmission. We determine workplace transmission by some of the following criteria. So there's kind of 4 points here. And if all 4 are true, then we determine it as workplace transmission. So first is 2 or more positive cases that are within 14 days of each other. There's a plausible epidemiological link in the workplace, and there's no other known link outside of the workplace. So a plausible epidemiology link means maybe they work the same shift, they work in the same building, they share a break room or a restroom. Basically, it's possible that they did come into contact with each other. As far as reporting outbreaks, if there are 2 or more employees that test positive within a 14-day period, or if you suspect that it's spreading through your work site, that's when you're required to report that. And that can be reported to the email listed here, livingenvironment@srhd.org. That's the preferred method. You can also call the number listed here. And then, so once there is an outbreak at a business, we work together to figure out what's best for the business. We go through all the consult steps that we mentioned earlier, as far as identifying positives, close contacts, talking about prevention measures, but we put an extra focus on figuring out where the transmission may have happened, whether there were any weak spots, and then new practices to implement to prevent further spread. Will the business be closed? It very rarely comes to that. Typically, if a business is going to close because of cases, that's a decision that they've already made before we contact them. That decision is typically made by a business when they've had so many positive cases and close contacts that they aren't able to continue operations while those staff are quarantining or isolating. But we definitely look kind of at the numbers, look at the contacts to figure out what's going to be best. Will it be on the news? No, so this information is confidential, and you may see mention of outbreaks in the news sometimes, but those are situations where the information was put out there by the business or the facility. It's not something that's publicly sent out by us. So these are some areas where we have found transmission where there have been multiple cases within a business. So just some areas to keep in mind. Employees working the same or overlapping shifts. So if you have the capacity to limit overlapping in shifts to reduce exposure, that's a good idea. Or to have separate shifts where the employees don't mix between so that there's no exposure between the different sets of employees. That's a great option as well. Lunchrooms and break rooms, probably the most common place I hear of where employers are finding workplace transmission. And that's because it's a place where masks come off to eat or drink. People may be more relaxed and not adhere to the 6 feet distancing as well. So it's a good idea to have someone, maybe a manager or supervisor, monitoring it, stopping in once in a while, just to remind people. Some places have set capacity limits on their break room or taken out chairs, and then sending employees at different times, just staggering breaks if possible. Those are some things that kind of help with that. Smoke breaks, it's good to remind employees to distance even during those kinds of breaks and stagger those as well when possible. Carpooling is a good thing to remember to ask about when you're looking at close contacts and potential exposure. So if it's 2 employees riding to work together in a private car, we wouldn't consider it workplace transmission if there was spread between the 2, but it is an important thing to remember to ask about when you're identifying close contacts. And then outside of work, so kind of similar with carpooling, if employees are getting together socially outside of work and there's spread between them, it's not considered workplace transmission, but still a good thing to keep on your radar. If these kinds of social interactions happen, asking about it can help identify contacts that should be kept out of work in an effort to prevent further spread to other employees. And it's just a good idea to remind employees in general that their behavior outside of work matters and can make an impact on the workplace itself.
So regarding governor's office and DOH documents and how they apply to your workplace, well, in general, the governor's documents are law and they are mandatory to follow. The State Department of Health documents tend to be more guidance, like their cleaning guidance document or their ventilation document, unless it's specifically referred to in the governor's document that says that the DOH guidance has to be followed by a workplace. An example of this would be health screening. So screening employees, is this required? Yes, it is required under the governor's requirement documents. What are the options? Well, you can screen at the work site. That's probably the ideal, but there's also an option to have employees screen at home. You just want to make sure you've provided instructions on how to do it. And is temperature taking required? It's not required. It is recommended. There are instances where positive employees can be identified, and I've actually talked to a few businesses where this has happened. The employee didn't really have a whole lot of other symptoms, but they were pulled out with a temperature screen and found to be positive. So there is some benefit to that. And there is guidance on DOH's website. The link is on here. And one thing to do with the screening, to be really sure that you're asking the current questions. We've come across businesses that are using old guidance that doesn't include all of the symptoms, for instance. So these things are updated quite frequently, and it's just good to make sure you have the current questions on that. So what you want to look at for symptoms would be the fever or chills, the cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss or recent loss of taste or smell, sore throat, congestion, nausea or vomiting, and diarrhea. So there's a lot of symptoms included in that. And then a couple of the questions to ask are, within the last 14 days, have you had contact with anyone that you know of who had COVID-19 or COVID-like symptoms? And contact is being within 6 feet or closer for more than 15 minutes. And that can be cumulative. So not all necessarily in one stretch. It could be 3 5-minute increments over 24 hours. Or if you had direct contact with fluids from a person with COVID-19. Another question, have you had a positive COVID-19 test for active virus in the past 10 days? And then last question, within the last 14 days, has a public health or medical professional told you to self-monitor, self-isolate, or self-quarantine because of concerns with COVID-19? So for essential businesses, there's been a lot of questions around this. What is an essential business? Well, this was established by the governor's office back on March 25th under the governor's Stay Home, Stay Healthy Proclamation 20-25. And that's back when most business activities were closed, and only those businesses that were considered critical infrastructure to the functioning of society could remain operating. So there's an appendix associated with that, and the link is on the slide here. And that lists all the categories of businesses that are considered essential. So that's a good reference document to determine whether your business is considered essential or not. So what this allows, if a business is considered essential, it does give employers the option to have close contact employees continue working if absolutely necessary for the continuity of operations. So, but there are conditions to that, and the conditions are that the employee must be asymptomatic, they must test negative, they have to wear a mask at all times, and then take all necessary precautions like hand washing and things like that. Also, the employee must follow quarantine when they're outside of the workplace. They need to stay home. They can't be out shopping and things like that. There is a bit of an exception for healthcare workers. So there is an exception that allows positive employees to work if they're working with positive patients. So that would just be in like a hospital setting where there's a real shortage of staff. Otherwise, the employee has to test negative and be asymptomatic to be working. Should close contacts still quarantine? Yes. And in fact, the health district does recommend a 14-day quarantine for all close contacts. And the reason for this, it is the most protective of other employees and customers to prevent the spread of COVID-19. So the essential business option should really only be used if absolutely necessary to keep the business operating. Otherwise, there's a risk of spreading to other employees or customers. Can employees decide if they can work? No, that's really the business, the employer who has the discretion. They determine whether the employees can work or not. And then governor's business sector guidance. What if there's no specific governor's guidance for my business? Well, if there's no guidance for your business, but there is guidance for a similar type of activity, then you should follow that. An example of that was something that our office was dealing with, was just reviewing a plan for carriage rides in the city. And we referred to the agritourism guidance, which is governor's office guidance. That includes wagon rides. So a very similar activity. We did check with the governor's office. They said that was appropriate to use other guidance that's a very similar type of activity. So that would apply to businesses as well. Basically, all businesses are required to follow all of the general prevention principles. So face coverings and masks, this is a really popular topic. There's lots of options and lots of questions around this. So number one, when does a face covering and mask have to be worn? Well, basically L&I says that when employees are not working alone, they need to wear at least a face covering. And so that for most of the time, that includes most employees. The definition of not working alone from L&I is you're working in an office alone, or you're in a vehicle alone, no one else in there. You're maybe working outside well away from others, say like mowing a lawn, or you're inside a four-sided cubicle with walls that are high enough to block the breathing zone of others walking by. And the L&I Q&A link that's on the slide here has that answer to that question and a lot of other ones, so it's a really good reference. What type of mask should be worn? Well, for most workers, it's a cloth face covering is probably going to be sufficient if you're able to maintain at least a 6-foot distance and you're not doing a task that's high risk, like working with someone that maybe potentially has COVID. But for other tasks, you might need a surgical or procedure mask, or maybe even an N95. So the L&I document, which there's a link here to, which mask for which task, has a great table or chart there that tells you the types of activities. It gives examples. And that's a really great reference to try and figure out what type of mask or face covering you should wear. So, and L&I actually is also available to consult with businesses. They have a consultation group, which is different from their compliance group, and they're a great resource too for any questions or helping to make sure that complying with the L&I requirements. So what if an employee claims a medical exemption? Well, in this case, for an employer, you can ask for an accommodation statement from the employee's medical provider. So that is an option, just to confirm that that's the case. And if it is the case, then employers should try to provide some accommodations if possible. So if they can't wear a face covering, then maybe they can wear a face shield. And is that a substitute for a face covering? Well, it can be, but it has to be appropriate. And the infographic on the slide here shows the cloth drape around a face shield, and L&I considers that acceptable. But a face shield alone without that isn't. And the reason for that is because if there's no cloth material around the bottom of the shield, the air will just all escape. The exhaled air will escape without being filtered at all. So it's better than nothing, but it's not as good as even a cloth face covering. And so what if is shielding on a desk or a bench a substitute for face covering or distancing? Well, not really. However, they can provide some additional protection, especially for employees. You know, they're working at cash registers or maybe a receptionist. So they are worthwhile putting into place. It's just not going to reduce the 6-foot distancing that's required. So what if a customer refuses to wear a mask? Well, that's also was a common question, particularly earlier on in the pandemic. So if the customer claims that they're exempt for a medical disability, you cannot ask for proof, and there are no steps you needed to take to enforce that at all. You can offer them some alternatives, though. So that might be a curbside pickup, or to deliver some products to them, or maybe schedule an appointment when physical distancing is possible. But if a business does choose to allow them to enter, then they need to take additional safety precautions. And that could include things such as keeping doors and windows open, limiting the duration of the visit, employing additional physical distancing requirements, or providing no-touch payment type systems. So just remember, some individuals may be entitled to reasonable accommodations, and so businesses should be thoughtful of that and provide the accommodations to customers who do indicate they have a disability under ADA or the Washington Law Against Discrimination. Now, on the other hand, if a customer or individual absolutely refuses to wear a face covering, they refuse alternative service options, and they don't indicate that they are exempt from the requirement to wear a mask, then they should be asked politely to leave the premises. And the governor's office, they really say that under no circumstances should a business try to physically block a person or physically remove them. They don't want people to be put into a bad situation like that. So what they recommend is, if the individual refuses to leave, then the business representative should just follow whatever procedures they normally follow in that kind of a situation, and just follow through with that. There's a good link here at the bottom, this overview of COVID-19 statewide face covering requirements, and that includes all of this advice. Plus, it also has a link to a toolkit that has signage that businesses can use. So, really great resource.
Physical distancing. So when is it necessary? It should be maintained in all interactions, but there may be situations or tasks that come up where it's not feasible. In those cases, other prevention measures are required, such as the use of barriers or potentially a higher level face mask. Some situations where it might come up is with a 2-person carry. So 2 people would be required to be within that 6 feet. The important thing is just to distance whenever possible, and when not possible, limit the duration and the frequency of those kinds of interactions, and only do so when necessary. And so, as far as reducing risk, it's impossible to eliminate all potential exposure. So it's important to just reduce risk wherever possible. So some things that you can do are to follow the recommended workplace precautions, and then teleworking when possible is even better. Even if it is a pretty low risk work situation, it can take potential exposure risk from low to none at all. So that's a great option if it's available. Following precautions outside of work as well is very important. Treating everyone like they may be contagious, because they really may be. People are contagious 2 days before they develop symptoms, and a lot of people are asymptomatic as well. So it's best just to take all the precautions and assume that everyone might be contagious. And then wearing your face covering, of course. So it protects the wearer as well as others. So that's another important thing to remember.
So there's a new application that probably everybody has seen now, put out by the state of Washington, and it's the WA Notify, which is available for cell phones. And I believe probably about 100 or 1.4 million Washingtonians have already downloaded it. The great thing about this app is that your privacy is guaranteed. They won't know where you are or be able to track you. But if you are registered to use it, you'll be notified if you are a close contact to a person who tests positive for COVID-19. And it can tell if you've been within 6 feet for 15 minutes or more of that person without knowing your exact location. So it's something for employers to consider, maybe encouraging their employees to sign up for, because again, it's another great prevention tool to stop the spread of COVID-19. So we've had some questions at the Health District recently just about the new COVID-19 vaccines that are coming out. Still, there's plans being developed. There's committees that have been established. CDC is still working on guidance for a timetable of vaccination in terms of who will be the next group of people to receive the vaccine. We'll be posting information on our website and probably an FAQ coming up here soon with more information as we find out what the priorities are going to be. So keep checking for updates on that. And then these are some good resources on COVID-19. So feel free to check these out. We also do want to note that this presentation is based on the current guidance through DOH, CDC, and the Governor's Office and LNI. This information does change frequently, so it really is recommended that employers check that guidance regularly for updates to make sure they're current with the most current information.